Hello, I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. I've started a series of OET speaking topics and role plays, and today's topic is for the doctors. It's a medicine topic. Practice is the setting is suburban general practice. Before I start with the topic, there is important information which I want to give to you that my book is coming very soon. This is Crack OET at the first time. This will help you a lot to get the best techniques, to get 450 plus in all the videos, because this book is my research or my experience of last 10 years. And apart from that, I have been teaching IELTS for the last 20 years. So this is the accumulated experience of mine, which will be helpful for many students to get their desired score in OET. And if you want to appear in the coming 2 to 3 months, then you can pre-book your copy, which is going to help you a lot. Fine. Now let's start with the topic. Doctors, this is a topic where the patient is 34 years and she's apprehensive about skin cancer, as she has a family history of skin cancer and she's quite scared of that. You have to start the topic by greeting the patient, and he may say that, hello, my name is Dr. So-and-so, and I am in charge of the suburban general practice, or I am your attending doctor today. Then you have to ask the concern, what brings you here, or how may I help you? Patient will tell you that, doctor, my husband has seen a lesion on my back, and which has made me upset. Then you have to ask that, what is the reason why you're scared of that? So the patient will tell that, actually I have a significant family, strong family history of skin cancer, as her father too had, and he has some aunt who died of this. So this is written in the patient's topic, that she has a significant family history of skin cancer, as she has seen the complications of skin cancer and the patient struggling from the dreadful results of chemotherapy and radiotherapy. So that's the reason she doesn't want to have this. And he wants this mole or that lesion to be removed as soon as possible. In such of the cases, doctor, you may take a pause and you may ask the patient or may get the permission from the patient. May I examine you first? Then the patient will say that, yes, doctor, you should examine. Then after examination, you can give your diagnosis. You can tell the patient that it is nothing to be get alarmed about, because I have seen that this does not seem to be a cancerous lesion. Sometimes these lesions appear in the body and they may disappear. Sometimes they are on the body, but we do not notice them. Uh, you have to ask certain questions to the patient, like, when did you notice this? Then the patient will tell that my husband noticed this last night, and they did not waste time and immediately came to you. Then your next question will be that, is it painful? Or has he seen the changes in the lesion, whether it was small earlier and it has been turned bigger into size, or he has seen the changes in the color of the lesion? As the patient is unaware about that, because last night only the husband told her about the lesion and she's not able to tell this thing. Then you have to tell that sometimes such type of lesions are in the form of the birthmark or the mole, which are present on the body, but these are not noticed for a long time. As this lesion has been seen by your husband, and we can observe it in the future also, but at this time I do not suspect it to be cancerous, because cancerous lesions of the moles are different type of. These are of the irregular borders, and there's this color, and they have some specific features in that. But I'm not finding any type of such feature in your case. So in this case, I won't suggest you to remove this lesion. And secondly, as you have told about your family history, I'm really feeling sorry for that. and I don't want you to suffer like that. But it is not advisable by only being apprehensive about your family history. You should take such step and becoming unnecessarily stressed. Then the last part is explain the treatment, excising the lesion under local anesthesia and excisional biopsy and using histopathological examination. That is, if the patient insists you that, doctor, I want to get this lesion excised, in that case, you can tell the patient about the procedure, that we can perform a procedure on you, that is the excising the lesion. And she may ask you that, would it be painful? Then you have to tell that it will be performed under local anesthesia. In that case, the patient will not find any problem. As she's scared or frightful, in that case, you can say that we can do the biopsy of this lesion to make you sure or make you stress-free. Because in the biopsy, we can get the exact picture or exact findings, and we can make the diagnosis of that. And hopefully, this lesion seems not to be cancerous, but still, if you are getting worried about this, in that case, we can perform this excision procedure and we can take the biopsy. Biopsy is a small piece is to be taken, and that is sent for the histological investigations. Then after that, to determine the nature of the lesion, a simple process can be done. There's a minimal risk available. So this is all we have already gone with it. Then explain the procedure. If the lesion is malignant, urgent referral to a surgeon. So then you may say that, Sophia, in the worst cases, otherwise it does not seem to be cancerous, but suppose if seems to be cancerous, in that case, urgent surgery will be required. So I'll set your appointment with the surgeon, and we can get urgent surgery appointment from him to get it done, completely vanished from your body. Then after that, if it is cancer, obviously, then the chemotherapy or radiotherapy will be done. But again, assure the patient that this does not seem to be cancer, but only for your concern or to convince you, I can do biopsy on this lesion so that you should become stress-free. But in the worst cases, if it is found to be cancer, in that case also we have the solution. But it is nothing to get alarmed about, because if it would be, in that case also, it would be at the initial stage and it will be treated. At the end, you should ask the patient that I'm giving you an appointment after 2 days for the biopsy. Do come for the biopsy. And only after the biopsy, we can take the next step. So in this way, you can end up the task. And so this was all about this task. If you like this video, do not forget to like and share it with your friends and colleagues. And if you have not subscribed our channel yet, subscribe it right now so that you should get the latest information on our channel whenever we are uploading any new video. Hope this video will be helpful for you. Stay healthy, happy learning, stay connected.